Hey, everybody, it's your Congressman, Jamie Raskin. I'm shouting out to all my friends in Maryland's beautiful 8th Congressional District and across Maryland and across America who tune in for my favorite time of the week, Local Hero, when we get to celebrate the people who make life in the 8th Congressional District so extraordinary. I've got an amazing local hero for you. Born and raised, grown up in Montgomery County. He's got 5 kids of his own now in Montgomery County. And next week, we're observing National Community Health Center Week. And our hero this week is Dr. Tollie Elliott Sr., the Chief Executive Officer of Mary Center. And I've gotten to do some work with Dr. Elliott, and he's a remarkable leader. He's a remarkable doctor. He went to public schools here. I think he went to Springbrook, if I'm not mistaken. And his kids have all gone to the public schools in Montgomery County. He went to Howard as an undergrad. He went to Howard Med School. He's taught and worked at Georgetown and Providence Hospital, like throughout the area. But now he runs Mary Center. He was the chief medical officer for 6 years before that. And he's been instrumental in just designing and developing and implementing the best community health center that anybody's ever seen around here. And he inaugurated a telemedicine program, the first federally qualified health center. That one was in DC, which is part of the Mary Center complex. He has served as director of the OBGYN peer review, a member of the surgical case review committee at Providence Hospital. He's just done remarkable things in the medical community with a determination to get the best possible healthcare to our people. So for this and for everything you do, Dr. Elliott, you're our local hero this first week of August.
Well, Congressman Raskin, thank you so much. I'm very humbled by those comments and words. And I would say that if there's anything behind everything you said, it is I have the privilege to serve and to be in service of others.
Well, you certainly serve us beautifully. I know best the Mary Center Silver Spring site. I think I was there most recently, actually, with Kamala Harris's husband,
Yes.
The second gentleman, Doug Emhoff. I think we were on a tour there at the end of 2021. But I've been there a lot because you guys are doing such amazing stuff, and you were such a critical actor during COVID-19 in our community. But the Silver Spring Mary Center is part of a constellation, right?
Yes.
Just
Yes.
tell us everything you oversee.
So Mary Center, again, we're in our 36th year, founded by nurse Maria Gomez. And we have 5 clinical locations, 3 in the district, 1 in Silver Spring, 1 at Adelphi in Prince George's County. We have 2 senior wellness centers that we co-manage with the Department of Aging and Community Living in the District of Columbia. We have 28 school-based mental health therapists in the district, and we have 1 school-based mental health therapist at High Point High School. I would say that medical, dental, behavioral health, a myriad of social services. And I would like to call our Siamese twin. We have a charter school affiliated with us called Bria Public Charter School that works with us in terms of early childhood and adult education, 2Gen learning. I'm very proud of that and what they do working with us. We have a medical assistant training program. We have a childhood development associate program, really trying to create career ladders. And lastly, we just added a dental assistant training program to help promote. We have 20 patient care navigators who have all signed up, sponsored by Mary Center, to help them become dental assistants so we can increase our capacity and ability to serve.
Remarkable. Next week is Community Health Clinic Week. Tell us what a community health center really is and
Right.
where it fits into our overall healthcare system.
So many people think of a community health center as a free clinic. A community health center is so much more. I would like to say it's a hub. I would oftentimes call community health centers a health sanctuary, places where people have nowhere else to go. We take all types of insurances. I would say that what's unique about federally qualified health centers and community health centers is that we will see people regardless of their ability to pay. And so it is extremely important that everybody understands that irrespective of your status in life, we can help you. And so if we're at capacity, we will work with one of our sister clinics to put you in there. And so across the country, through the Health Resources Services Administration, there are approximately 1,400 entities serving across 11,000, close to 12,000 sites across the US and territories that take care of approximately 30 million people. We are the largest primary care network in the United States and the territories. So we do a massive, massive undertaking of taking care of the nation, really.
Huh. And so in terms of your own career, you've been a practicing doctor, I think OBGYN, right?
Yes.
For a long time. Then you became the CMO, the Chief Medical Officer at Mary Center, and now you're CEO of the whole operation.
Right.
To what extent has that taken you away from direct patient service? And how do you experience that in terms of your own life and career?
That's a fantastic question. I was extremely busy at Providence, and as you stated, I have 5 children, and I realized that it's important to not only as you take care of your patients, but also take care of yourself. And I recognized that I would always tell my patients that I'm going to treat you just like I treat my family. So I had to really consider how that was. And so I had been working in Providence for 10 and a half years, extremely busy. And then an opportunity came by and I was offered, they expressed an interest. Would you like to apply for the chief medical officer role at Mary Center? I was very familiar with Mary Center, fantastic things. And I said, no. And they said, why? I said, because I thoroughly enjoy my patient connection. I've taken care of mothers, grandmothers, daughters. Many people bring their sisters through. So to this day, I still have people saying, "Quinn, will you please open up an office so I can see again?" And so it was a wonderful thing, but I had a long talk with friends and family, and I chose to pursue this as the chief medical officer. And at first I had some doubts. And then I realized as I got into this wonderful space that was created, that I could have an impact on more than one person at a time. I could look at systems. I could look at how we could grow. I could look at communities that were not receiving the care that they deserved or access to certain spaces that they deserved. And as I joined this team with great support from the CEO, we saw ourselves add an ultrasound clinic for low risk obstetrics. We've added infectious disease. We've added addiction services. We've added GI. So we had this wonderful thing that's grown from 34,000, what we call participants, because we do more than just healthcare, to approximately 65,000. And never in a million years did I ever think that I was going to be doing the administrative side of medicine. I thought I was going to be a very old man delivering babies at the side of the bed, knowing this community. And it's just been a fantastic experience watching people shine, helping the staff grow, working with our people team, our HR team, building that staff. So I think that from a patient side, I still engage with providers. I still have people talk to me on a clinical space, but I recognize that my value is in an administrative space too.
It's always impressed me how Mary Center is such a proactive force in the community. I remember COVID-19, you guys were like the first people out there in the neighborhoods talking to people about COVID, getting vaccination. And I'm sure you had a lot to do with the fact that Montgomery County was pretty much #1 in the state in terms of ability to get people vaccinated and turn the tide on the disease. Tell me about mental health and addiction, which is, a plague and an epidemic of its own in the country now, and what you guys are doing to try to get on top of that.
About 7 years ago, Daniel Smith, a family practice doctor, had just come in and asked if he could start using Suboxone management. And at the time, me coming straight out of the hospital, I said, look, tell me more about Suboxone. He talked about opioid abuse and how that was used for recovery. And I said, great, let's try it. So it started off with just him. And other providers started seeing a difference. And to date, it's about 7 years in, we've had about 10,000 encounters. We have a number of providers that are also doing opioid dependency and management. He is now the director of addiction services. But the sad part is there's just not enough providers out there. And the impact of what's happening with substance use disorder is just tremendous. It's impacting everybody from youth to the elderly. And it just speaks to other social ills or other components that contribute to why an individual may fall into that space. And so that's where a place like Mary Center is really important, because when people come in, they meet with more than just the provider. They meet with a family support worker who screens them, who identifies are there other areas of need. And so when we see behavioral health and when we manage and deal with them as individuals, we really look at the whole person, not necessarily you're dependent on something. But it's a challenge. And I think with great credit to Dr. Smith and his work on the medical side, and Dr. Williams and the other leaders in the behavioral health side, we've done a lot of work in bringing on more and more behavioral health providers. But even now, there's still just not enough. And even more, there's fewer providers of color. Mary Center is about 98% of the individuals are minority. 2/3 are Hispanic, and the largest group is African American. And so you'll find that it's really hard. About 5.6% of all physicians or providers, physicians in the country are Hispanic, and about 5.2% are African American. So you can only imagine when you have a population that is comprised of 98, 99% minority, it's really hard to find a provider that looks like them. And so what we found is that those connections make a difference. And having somebody that's culturally competent, speaks their language, is huge in terms of making an impact.
Dr. Tollie Elliott, you are such a major positive force in our community in Montgomery County, as well as Prince George's County, as well as Washington, D.C. We're thrilled that you've made this commitment to us through Mary Center. You're able to pursue your dreams here with your beautiful family of 5 kids and your wife. And also you do music and traveling. You've got other hobbies. You've got some good work-life balance. So thank you for everything you do. You are a local hero. I hope everybody emails you, calls you, and congratulates you on all the great work.
Well, thank you for those kind words. It's my home. We were taught to go back to the communities we came from and serve. So it's definitely a privilege to be in service to others. So thank you so very much. And I represent Mary Center too. So we're so happy to be here.
Well, we're proud to have you, and we're proud to have Mary Center too.